Diagnosis by visceral organs. We continue with spleen illnesses. Spleen not controlling blood. Inability of the spleen to regulate blood circulation is due to deficiency of spleen qi. This condition results from chronic illnesses or injury to the spleen by chronic fatigue. When spleen qi is deficient, the spleen cannot regulate blood circulation so that blood extravasates instead of flowing within normal channels. This in turn leads to a variety of bleeding. The main types of bleeding are hematochezia, hematuria, subcutaneous bleeding, excessive menses, and metorrhagia. In addition to bleeding, the typical syndrome includes pallid complexion, lassitude with weakness, shortness of breath, with reluctance to speak, reduced eating and loose feces, a pale tongue, and a thread-like and feeble pulse. Cold dampness encumbering spleen. This refers to strong cold and dampness in the interior, trapping the spleen yang and incapacitating it. The condition arises in two circumstances. In one, unregulated dietary overindulgence, especially of raw and cold foods, leads to endogenous cold and dampness. In the another, exogenous cold and dampness invade the interior in a patient excessively exposed to rain, immersed in water, or residing in a cold and damp environment. Internal accumulation of cold and dampness causes trapping of spleen yang. Failure of spleen yang to circulate and act leads to retention of water and accumulation of dampness, obstructs movement of qi, and impairs ascending and descending functions of spleen and stomach. The typical syndrome of cold dampness encumbering the spleen includes epigastric distension, stickiness in the mouth, anorexia, loose feces, nausea and heaviness in the head and the body, dusky and sallow complexion or yellow skin, pale tongue with white greasy coating, soft and even pulse. Dampness heat lodging in spleen. This is the condition of dampness and heat lodging in the middle jaw and blocking its activities. The condition may result from exogenous dampness and heat invading and lodging in the middle jaw or from endogenous dampness and heat arising from improper diet, especially overindulgence in sweet foods and alcohol. Dampness and heat lodging in the middle jaw block the activities of the spleen and the stomach or disturbs the liver and the gallbladder and steams the superficies. For the spleen and the stomach, this results in dysfunction of digestion, transportation, ascent, and descent. For the liver and the gallbladder, this results in dysfunction of dispersion and excretion. There are two main patterns of symptoms of dampness heat lodging in the spleen. In one, there are epigastric distension, nausea and anorexia, heaviness in the body and limbs, thickeness and bitter taste in the mouth, jaundice like bright orange. In the alternate pattern, there are prostrating fever, fever not relieved by sweating, foul-smelling diarrhea, and scant dark red urine. In both patterns, the tongue is red with yellow greasy coating and the pulse is soft and rapid. Thank you for your attention.